Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in the previous video we discussed subject wise discussion. I started from community health nursing. So we discussed one set of questions from community health nursing, and this video is the continuation of that first video. Here we can see the next set of questions. Next question number 16. OPV vaccine was discovered in, and options: option A 1944, option B 1957, option C 1952, and option D 1946. Correct answer is option B 1957. OPV vaccine was discovered in 1957. The next question, group on medical education and support manpower is popularly known as. Options are: option A Boer Committee, option B Mudaliar Committee, option C Qatar Singh Committee, option D Srivastav Committee. Here correct answer is option D Srivastav Committee. The Government of India and the Ministry of Health and Family Planning held a group on medical education and support manpower, and this is popularly known as Srivastava Committee, and the committee has set up in the year April 1975. The year is also important. It has started in 1975. And the next question, in which state Beti Bachao, Beti Padhao scheme was started? Options are: option A Bihar, option B Uttar Pradesh, option C Haryana, option D Rajasthan. So here correct answer is option C Haryana. Haryana started Beti Bachao, Beti Padhao scheme. And this scheme was started in 22 January 2015. Year is very important, 22 January 2015, and the main aim of this scheme is to generate awareness and improve efficiency of welfare services intended for girls in India. And next question, TB Association of India was formed in, and our options: option A 1920, option B 1950, option C 1939, option D 1926. Here correct answer is option C 1939. TB Association of India was formed in 1939. Move on to next question. Black Death term is used for, and our options: option A dengue, option B Kala Azar, option B plague, option D tetanus. Black Death term. Okay, correct answer is option C plague. Black Death term is used for plague, but black sickness is used for Kala Azar. Black sickness is Kala Azar, black death is plague. Move on to next question. Secondary attack of chicken pox is. Options are: option A 90%, option B 70%, option C 50%, and option D 0%. Secondary attack of chicken pox. Correct answer is option A 90%. Here the question is secondary attack of chicken pox. Okay, secondary attack means the disease or the infection is spreading to the family or other members or a specific group. Okay, that is known as secondary attack. Okay, secondary attack of this chicken pox is 90%. Chances for getting infection to other person. Okay. Suppose if the question is coming, second attack of chicken pox means 0%. Second attack means same person is getting again chicken pox. That is the second attack. Secondary attack and second attack. Second attack means it is 0%. Secondary attack means it is 90%. Okay, it's an important question. Chickenpox. Chickenpox is the causative organism for this chickenpox is varicella zoster, and the incubation period of chickenpox is 14 to 16 days, and the isolation needed for this chickenpox is 6 days after onset of rash. Okay, these points all important. And the rashes of chickenpox is pleomorphism, that is all the stages of rashes are seen and the rashes are superficial, centripetal and symmetrical. Okay, that also important point. And the next question is incineration is not done for. Options are option A cytotoxic drugs, option B sharp waste, option C human anatomical waste and option D all of this. Question is incineration is not done for. Correct answer is option B sharp waste. Incineration means using high temperature with oxidation method. Okay, that is incineration. And this incineration, the temperature is 850 degrees Celsius to 1150 degrees Celsius. Okay, this is important point. Temperature used in incineration is 850 degrees Celsius to 1150 degrees Celsius. This incineration is not used in sharp waste because that sharp waste will not burn. Okay, remaining they will burn and get ashes, but the sharp waste will not burn under this high temperature. Okay. Move on to next question. Methods of waste disposal in small camp is. Options are option A burial, option B land filling, option C incineration, option D dumping. And the correct answer is option A burial. The method of waste disposal in small camp is burial method, burial type. And the next question, according to IMNCI, patient treated at home should give which color coding? Option A yellow, option B pink, option C green, option D black. Correct answer is option C green. IMNCI means Integrated Management of Neonatal and Childhood Illness. Okay, and this started at the year 2006. And the color coding for IMNCI is yellow, which is used in for hospital patient, and pink color, which is used for a referral code, and green color, which is used in home treatment. Here our question is the patient treated at home should give which color coding? So green color is used to give at home care treatment, pink for referral code, yellow for hospital treatment. Okay. And the next question, one urban PHC is set for. Options are option A 1000 population, option B 50,000 population, option C 10,000 population, option D 5,000 population. Correct answer is option B 50,000 population. One urban PHC is set for 50,000 population. But in case of rural and plain areas, okay, one PHC covers 30,000 population in plain and rural areas. And in case of hilly tribal areas, it covers 20,000 population. Okay. In urban area, one PHC cover 50,000 population. In plain area and rural area, it covers 30,000 population. In hilly, tribal and desert area, it covers 20,000 population. Okay. And the next question. One mini Anganwadi worker is for. Options are option A 150 to 400 population, option B 400 to 800 population, option C 500 to 900 population and option D 250 to 500 population. Correct answer is option A 150 to 400 population. One mini Anganwadi worker is set for 150 to 400 population. One Anganwadi worker is set for 400 to 800 population. Okay. One mini Anganwadi worker 150 to 400. One Anganwadi worker for 400 to 800 population. Move on to the next question. Question number 27. Incubation period of meningitis is. Options are option A 1 to 2 days, option B 3 to 4 days, option C 4 to 6 days, option D 6 to 8 days. And the correct answer is option B, 3 to 4 days is the incubation period of meningitis. And the causative organism for this meningitis is Neisseria meningitidis. And the isolation period for this meningitis is 6 hours after antibiotic treatment. Okay, meningitis, and the incubation period is 3 to 4 days. Option B is the correct answer. On to next question. Causative organism of plague is. Options are option A, flavivirus, option B, Yersinia pestis, option C, Bordetella, option D, Coxella. And the correct answer is option B, Yersinia pestis is the causative organism of plague. And the remaining option, flavivirus, option A, flavivirus, which usually cause yellow fever, and Bordetella pertussis, which cause pertussis, and Coxella burnetii, which cause Q fever. Okay, here option B, Yersinia pestis, which cause plague. And the next question, which statement is true regarding BCG? Options are option A, distilled water is used for dilution. Option B, WHO recommended Danish 1331 for vaccine production. Option C, site of injection is cleaned with spirit. Option D, all of this. So question is, which statement is true regarding BCG? And the correct answer is option B, WHO recommended Danish 1331 for vaccine production. Danish 1331 is a stain which is used for the production of BCG. BCG means Bacillus calmette curae. Okay, this is given. BCG vaccine is given at birth. That is, the dose is 0.05 ml at birth. This BCG is dissolved in normal saline. So option A is wrong. Distilled water is used for dilution. It is dissolved in normal saline. Okay, and site for injection is cleaned with spirit. Site for injection is not cleaned with spirit. Okay, that is also wrong. Regarding this BCG vaccine is given in tuberculin syringe, that is 26 gauge. That is also important point. Another one important point is the permanent scar occur in BCG vaccination. Okay, the scar occur after 6 to 12 week of injection. That is also important point regarding BCG. The next question, child survival and safe motherhood program is on. Options are option A 1985, option B 1982, option C 1992, option D 1982. Correct answer is option C 1992. Child survival and safe motherhood program is on 1992. Move on to next question. Viral disease characterized by non-suppurative enlargement and tenderness of parotid gland is known as. Options are option A measles, option B mumps, option C malaria, option D meningitis. Correct answer is option B mumps. Okay, mumps is a viral disease which is characterized by non-suppurative enlargement, that is not pus forming enlargement, and tenderness occurs on the parotid gland. Option B mumps is the correct answer. The next question, the point at which chlorine demand of the water is fully satisfied is known as. And the options are option A safe point, option B break point, option C boiling point, option D none of this. Here correct answer is option B. Break point is the point at which the chlorine demand of the water is fully satisfied. Option B is the correct answer. And the next question, transplacental transmission of disease is known as. Options are option A acquired infection, option B vertical transmission, option C iatrogenic infections, option D none of this. And the correct answer is option B vertical transmission. Transplacental transmission, that is from mother to fetus, is known as vertical transmission. The next question and the last question in the series, sleeping sickness is transmitted by. And options, option A sandfly, option B ratfly, option C testis fly, option D mosquito. And the correct answer is option C testis fly, which transmits sleeping sickness. Okay. So the next set of questions we can see in the next video. Thank you for watching my channel. Keep going.